So what is a challenge that you guys have faced in working together, and how did you overcome that?
In this leadership program, there was a study done, a company that specializes in taking existing companies, and they took this company that was failing and turned it around. To do that, difference of opinions happened. You had people that told some people who put their creative ideas on the board, that's not a good idea. I don't think this will work. And they had to be okay with that. Safe spaces are critical when you have difference of opinion, and don't let your ego get in the way of team bonding and team building.
Hi everyone, welcome to this episode on the Happy Practice Playbook. I'm Mo Jones, and in each episode of the show, you'll hear conversations with dentists, office managers, staff, and specialists who know how to create a happy practice. Today, we're joined by Doctors Stephanie R. Ganter and Robert G. McNeill. Dr. Ganter is a talented board-certified periodontal and implant surgeon, and Dr. McNeill is an experienced oral and maxillofacial surgeon who is also a board member with the Texas State Dental Board of Examiners. Together, they are the duo behind the YouTube channel Between Two Teeth. Steph, and Bobby, welcome to the show.
What's up?
So good to be here.
How's it going, Mo?
It's good. I gotta say though, this might be like a change of pace for you guys, a podcast versus your YouTube channel.
Oh, you know what? We like to consider ourselves dynamic. You might think differently about us at the end of this, but we're gonna try.
Listen, you're just expanding all the mediums, and you're just slowly taking them over, slowly, bit by bit. You're gonna own the world domination, right?
There you go.
Collaboration.
Well, we were going for slightly less than that.
Communication.
Communication and connection. That was, and quite frankly, especially as everything's developing right now, trying to figure out what is the appropriate medium. I think for y'all to kind of reach out to people, I love that you incorporate happy in what you're doing, because especially coming out of COVID, that's a little bit of a challenge for a lot of people, a lot of practices, and there's a lot to be happy about. And there's a lot of things you can do to push happiness. So that's what we're trying to figure out.
I mean, honestly, already, I feel like you guys have nailed it. I feel like the vibe is there, and you're just ready to go.
Oh, that's good.
Right?
That's why high five. Yes.
High five. There we go.
Mo, we appreciate that. Thank you guys so much.
But a lot of it, Mo, is about attitude. And you can certainly look at something and say glass half full versus half empty. I usually kind of mix that up. But you're in a situation, there's always going to be multiple blessings from whatever happens, and trying to sort out what's the universe trying to tell me on this.
And I like how you say multiple blessings there, Bobby. And I look at it almost as there's multiple perspectives. There's a lot of different ways you can look at a certain situation. And I don't know if you're like me, I'm the world is melting kind of person. So, you wake up in the morning, maybe you got up late, I don't know, or something's not going quite right.
Probably.
But yeah, you're not wrong. But, at the same time, maybe you missed that accident on the way to work. Who knows? Yeah. Or maybe you show up and you happen to meet somebody walking into the building that you needed to see that day.
And you can have a challenging patient, and you can walk in and say, oh my gosh, this is absolutely going to be tricky. Or you say, this is a challenge. I think I'm up to the challenge. I'm going to use my skill set.
Oh my gosh, word selection key. I love it, Bobby.
So real quick, because you guys had mentioned something about like maybe you come in, you kind of have like a bad patient experience, right? That reminds me, because we always start off our show with a quick statistic, and our statistic today is related to that. So it's as many as 28% of consumers switch dentists after having a poor experience, such as unclear communication or a long wait time for a scheduled appointment during a visit. How have you guys worked through patient mishaps?
Oh, great question. And, for us, I would say it all starts with communication. And, we're two people, we're real busy, especially during the day. And you're right, patients, it's hard to have concierge treatment 24 hours a day, 7 days a week for our patients, but we try. And I think patients, they want to be treated like people. I was having lunch with another doc in our area today, and the biggest part of our conversation was, and it goes back to word selection, is they're not patients, they're people. And people come in with so many different things going on in their life. It's not just the teeth. And I would argue that most of the time it's not about the teeth.
And for between two teeth, we often say it's actually not about the teeth.
Yeah.
It's the person behind it. It's the people in your office. It's not just the doctors. It's an entire staff approach.
It's a team effort.
We do a lot of role playing of saying, okay, here's how this person's presenting. How do you help manage that?
The cool thing about being a dentist and we, as specialists, we probably see it a little more so, is nobody wants to be in our chair, by the way.
Right.
No one wants to be there that day. Some people are having the worst day of their year.
And once again, you can use that as a challenge to overcome, or you can let that tear you down. And letting that tear you down is a tricky thing. This is a lifelong sort of process. I did my MBA in healthcare management and leadership and finished that a couple of years ago. And one of the biggest components of the MBA training was soft skills, communication. If you say a word and you're not looking at what the person, how they're reacting to it, and it's not going to be what they say. Yeah, if you get that look, that's a challenge. You should modify the next word you say. It's not just the words you use, but it's how you say it.
Absolutely. And I'll give a plug for Bobby here. He does
a plug.
Yes.
Oh,
I got a shameless plug. I've never met anyone who can have word selection quite as good as you do. Mm-hmm. And also it's your melody, it's your pace and tone. And Mo Jones, I'm going to brag on you too. In part because the minute I met you, oh my gosh, your energy, your vibe, you're fun, you're bubbly. I want to talk to you.
Yes.
So I hope that kind of answers the question.
Yes, and now you've got me blushing, if it's possible to see that I'm blushing.
But that's so true. And it's all those things. It's usually not the words. It's how you say it. It's appropriate pacing of all of that. Giving some strategic pauses. To your point about patience, when you see how they're reacting, hitting the pause button and say, it seems as though you're pretty distressed about this process.
Right.
How can I help you feel more comfortable? When I see a patient sort of going in a certain direction, I may say, let's pause and talk about how we're actually going to make you comfortable.
Oh, I love all that. And Mo, I'm going to keep moving us along here.
Yes, she is.
You're
I will
good.
talk and talk.
No, this is great though, because you guys are talking, I really think you're talking about having authenticity in your practice and with your patients, right? And so with that, how does enabling authenticity in your practice allow you to fulfill your potential, not only as a dentist, but as a person outside of your practice as well? Or does it?
Authenticity it's just the building blocks of relationships. And if you're having a relationship with someone, whether it's a person in the chair or another doc or our assistants, and you kind of had mentioned it earlier, this team dynamic, it's all on a ground or a base of authenticity. One of the things that I like most of how we build authenticity in our community is we're sitting on a blue couch right now, by the way. That's right. This blue couch is super special because we have study club meetings where a lot of docs come to our office and we all kind of huddle in this office. And the nice thing is it creates an environment, a safe space, and a space where people can be vulnerable and let their authentic self shine.
That's actually a really good point. And it's funny because that's in part why we started our YouTube channel, was the connection that would happen on this couch and in this office space before we'd have a meeting. It was kind of, as Steph calls it, the meeting before the meeting. Yeah. And such strong connections would happen. And then we're like, how can we do something like this for a larger audience? And maybe it's dentists, maybe it's the entire dental community, maybe it's all healthcare professionals, maybe it's anybody, people that are trying to sort things out. You know, you're kind of a 30-something person.
We're going to leave it at that.
And we'll leave it at that. Or maybe 20, hard to say, maybe 20-ish.
Give me some doubt here.
You're trying to start out as would you call yourself a tooth professional?
Teeth.
Teeth professional.
Multiple teeth. I'll go for more than one tooth.
So you're starting out a professional career. You've finished training, you went to dental school, you did a residency, you did an integrative medicine fellowship, you've done a bunch of stuff.
Man, Doc, thanks.
Yeah, there you go. Well, so it's
been
a while.
Nice.
It's been a while. But you're trying to figure out what's your next step. How do I develop professionally? And I'm in a little bit of a different situation where I've been doing things for a while and have done a lot of the mistakes, a lot of challenges, had an awful lot of failure. How do you move past that? What do you learn from that?
I love that point you're bringing up.
So we get different perspectives.
Different perspectives, and it's all the biggest part. And this is where you've come in. And Blue Couch was kind of your idea from the start. Whenever
I love the color blue.
Whenever you're designing kind of this building along with the other partners in practice,
I need a couch right here.
Yes, and it worked out as a space where people could gather, and we could kind of go on. And again, I want to move on to other questions, but I hope that is somewhat sufficient for authenticity. It's a big part of what we do.
I did have a follow-up question. We were talking about the relationships that we build with people and building that authenticity, right? So bringing that back to the patients and building that relationship with your patients, right? As you are their physician, their dentist, how is in playing that part, being authentic with them and being a physician, how do you play a part in helping them live their best life?
Oh man, and all that's a great question. Thanks, Mo. We love part of patients coming into our practice. They're human beings, like we're talking about. They're people, and we want them to live their best life by when they leave, not just having their dental problem fixed, but we want them to think about life in a little bit different capacity. So that's why we ask them questions like, "Hey, what are your stress levels like?" Or, "Hey, I like your shoes." It's crazy if you really, when you talk about authenticity, there's so many times, and you brought this up, Bobby, at one point, we think really good thoughts about other people all day long, but maybe we're too nervous to say them, or maybe we think, oh, they don't want to hear that. And so something that we do at our office is we really encourage, if you do like somebody's shoes, say it. Or if you notice something about someone, you're like, oh, that's pretty cool. What's going on with that? It's very flattering. And someone can leave our office. Sure, they may have had a procedure, but they can leave our office feeling a little bit better about themselves and about the outlook for their life.
That all makes a lot of sense. And it really gets down to how would you want to be treated if you were in that situation?
Absolutely.
I think we've been lucky and blessed that we've sort of tried to take the financial component out of the equation and just say, if this was my brother, if this was my mother, what would I actually do? And to really sort of have that your practice philosophy. If you always try to do the right thing, you're going to fail at times. You're going to do some things that don't work. And if it's a higher risk procedure, then making sure the patient is on board with that through effective communication. You mentioned before, I'm on the state board. A lot of the state board challenges that happen is from poor communication. It's usually poor communication or a financial issue where expectations were not met, sort of on both of those things. And so working on that. Unfortunately, failure and doing the wrong thing can be a terrific teacher. You'd rather learn from other people's sort of challenges and mistakes, but there's...
Well, we all learn from each other. How about that?
We do. And I guess that's part of why we wanted to do Between Two Teeth.
Absolutely.
Is to get stories out there. We really do try to talk about failure. Do you fail much?
Not at all.
I fail constantly. And I do not let that stop me. Do you let failure stop you, or do you keep going?
I absolutely have let failure stop me. If I'm being completely honest, I'm scared of failure.
Sometimes failure is scary, and you're just like, I'm good. Tap out. I'm good. So I get that.
So the authentic answer is absolutely failure scares people. I learned how to wake surf the other day, and I was in a big boat of people, and some of the people were too scared to fail. And so they didn't want to go wake surfing. A simple example like that where fear stopped you. Can you imagine? So my point is that it's a very human thing to have fear drive our decisions. It's okay to be scared. It's so important to be honest about what scares us in life, because that's how people can have the courage. Because if they can connect with you on a fear, Boom. You just made a connection. And guess what? I'm a lot better at looking at failure in a more courageous attitude now than I used to be.
Do you tell people that you're scared? Do you say, this
all
really scares
the
me?
time? When I got a patient in the chair and they're about to have a procedure done, I'm like, oh, buddy, I hear you. I understand. Don't worry.
To empathize,
I get you.
Empathize, yes. And if you look at leadership skills and sort of tracking back to the MBA training that I did, sharing concerns with your team is appropriate. Things that, during COVID, for instance, no one knew what was really happening in those certainly very first few weeks, and saying, okay, I'm concerned. We're trying to set things up in a position where we are safe. Our patients are going to be safe. We're going to do our best to protect ourselves. There's some unknowns out there, but we are in this together. Versus
wonderful.
If you say nothing, that's a bad situation.
And Mo Jones, I'm going to keep us rolling. Do you have what other things
She's very good at that.
This is perfect because you guys, we're talking about authenticity, right? And you're talking about the building blocks that you've created. It's, being able to create an environment with your patients where they can trust you, right? You're communicating openly with them, and you're just, and it's then they're having these procedures and things, and then they're still coming back because it's safe and comfortable, and they can be vulnerable with you and let you know, hey, I'm scared, or I'm not looking forward to this. Hey, I get that. And it's going to be okay. I'm going to take care of you. So you have this in your practice, right? And I think looking at the both of you, because you guys are in a practice together, you guys have very strong personalities, and not in a bad way, but very different.
No,
and so
this guy,
how are you able to learn to work as a team while still being authentic to yourselves and to your values?
So one of the phrases I think of is iron sharpens iron. It's absolutely. It's challenging to work with another strong personality, but this is one of my big the opportunities that I want to share with colleagues and with people who are working within groups, is that just because you have someone that maybe intimidates you or scares you, or you might think they're better than you, it does not mean you need to run away and not work with that person or think illy of them. It's instead an opportunity to see, okay, well, why does this person scare me? Or why am I intimidated by them? They're probably just as strong or have something to teach you, or you can teach them.
And I love that part. You can look at it and you can push back against what's ever happening, or you look at it and say, what can I learn from that? Now, you're a periodontist. I'm an oral maxillofacial surgeon. We trained differently. There's overlap on some things we do. And quite frankly, there is an awful lot I can learn from you. There's an awful lot you can learn from me.
And if you had our staff in here right now, they'd give you a comical answer about what it's like to practice with both of us.
Yes.
And suffice it to say, I really do always kind of come back to that iron sharpens iron. It's not easy working with another strong personality. And a lot of times in my life, I've actually sought out kind of not isolation, but I like sometimes working by myself because of that. But guess what? I'm not getting any better. And you're going to achieve more as a team than you are as an individual. So there is something to working with other personalities that may intimidate you or scare you, or you're questioning a little bit.
And I would say it is important to be able to have fun. It's important to be able to laugh at yourself, laugh at the situation.
Yeah.
And sort of move past things. Life is more than just your practice. You are more than just a teeth professional, as stated earlier.
I'm going to get that printed on a sticker somewhere.
We're more than that. All of us are. We're not defined by our profession and what we do. There's so many more important things. And I think for us to look at, that's part of what Between Two Teeth is with the YouTube channel, is trying to meld maybe some professional stuff, some personal stuff. If you are not able to sort of take care of yourself from a wellness standpoint, personally, that's going to carry over into professionally. Once again, when we talk about things from a state board perspective, when people get into trouble with substance abuse and mental health issues, boy, oh boy, that it just derails the professional side.
Couldn't agree more, Doc. Mo Jones, what do you got?
Well, I was gonna say, going back to working together as a team, I think some of our listeners, as they're probably in a situation, most of them, where they have strong personalities they work with as well. So what is a challenge that you guys have faced in working together, and how did you overcome that?
You want me to? Can I have the first crack at this? I have a laundry list, but I'm just joking. One of the main things that I see, I serve on some boards, and one of the main things that I see is just a difference of opinion. It's you can work on a team with someone, but you have to respect that they might have a difference of opinion, and that's okay. It's okay to have someone disagree with you. That's actually important. If a team is going to work through some stuff. I'm taking a Harvard surgical leadership program right now. I know, la-di-da.
Fancy.
I know, don't be impressed.
Yeah,
I'm one of the least impressive people. Great program. One of the least impressive people on this cohort.
No, I'm not going to let you say that. It's mostly physicians. You show up as the only dentist there.
My point, thank you so much.
And you're making a significant impact on that class.
They actually reach out.
She paid me to say
that.
I
was walking in, I'll Venmo you. That's a millennial approach.
No,
so kind of getting back, you're right. Absolutely.
I'm in trouble there.
You're getting in trouble there. So my point here, and the important point, is that when you're working on a team here, and it's all about kind of difference of, it's okay to have a difference of opinion. And in this leadership program, there was a study done, a company that specializes in taking existing companies, whether they're retail, commercial, this one happened to be a movie theater somewhere in the world. And they took this company that was failing and turned it around. But to do that, their concept mapping, their team that had to create these new ideas, safe space. And difference of opinions happen. You had people that told some people who put their creative ideas on the board, that's not a good idea. I don't think this will work. And they had to be okay with that. Safe spaces are critical when you have difference of opinion, and don't let your ego get in the way of team bonding and team building.
Yes. And you want to be careful of groupthink. One of the challenges, you sit down with your staff, and if you're the doctor and you sit at the head of the table, say, here's our challenge. What's the solution? Doctors have a propensity, if you will, to intervene, and you're going to have people that are in that room that are very likely going to have a better answer. They're the ones answering the phones every day. They know sort of the nuances that go along with that, versus you're back in the operatory.
And I love that. And when you said groupthink, I'll make one last quick comment on this.
And
it won't be quick, but I'll try to make it quick. And it's important. So when you mention groupthink, I'm a people pleaser by my very nature, and I want to make people feel welcome and loved, and most importantly, I want them to like me.
You're a nice person.
Nice people are people pleasers to a fault sometimes, and I'm one of them. And when you say groupthink, people pleasers tend to engage in groupthink a little bit more than independent thinkers.
They'll be like, "Oh, that's a great idea."
Right. When instead you need to not fear failure or fear rejection, and you need to have the courage to say your opinion, even though it might get rejected, and it's okay.
I love doing that.
Right.
And I love trying to do
Bobby's not a people pleaser.
I don't
Let me tell you right now.
I don't get invited many places 2 or 3 times. Remember, you introduced me to someone the other day. You're like, "Oh, he's on the state board." That's the first thing you said.
I thought it was hilarious.
I'm like, don't come in hot that way. However, I like to make people happy. I like to make people feel comfortable. And I do. But at the same time, if something needs to be said, if something's doing something terribly wrong, hard truths is, and you can try to say it in a compassionate way.
And I love that. Let's keep going. Mo Jones, what you got?
So I think something interesting that you guys, as you were talking about a challenge, is first it's communicating and realizing that people are going to have different opinions than you, and realizing that everyone's unique voice is important, and essential to what you're bringing to your practice or to the table, right? And realizing that their perspective could gain something for you. But I think also, and you guys can tell me if I'm wrong, it seems like you guys have found your balance with each other too. You recognize each other's strengths and where that kind of balances the other out. Steph, you said you're a people pleaser. Bobby, you're like, I'm not a people pleaser. I like to be nice to people, but I am not a first instinct people pleaser. And I think for you guys in your practice, there's a good balance, because then you're not going to have a practice where it's just people pleasing and you have patients stepping all over you and then not successful. But then on the other hand, you don't have patients feeling like, okay, well, he doesn't care about me and he's just going to tell me what I need and I'm out of here. I'm not valued as a person. I feel like you guys have created that medium. And I think that's great for our listeners to take from that of, finding the balance and recognizing everyone's strengths and being able to work with that and creating a safe space where they can voice those opinions and they're not going to be shot down and be like, well, you have the stupidest ideas I've ever heard in my life. You can't say anything right. Being able to
That's like what you told me.
Yeah, I did say that to her about 35 minutes ago when she
But Mo, I love what you're saying, so please continue.
But I think, of course, that is really the heart of the authenticity of building a practice where your patients and your people feel good and they want to come back, whether it's coming back to work or coming back as a patient to get more treatments or services, right?
And being honest, having the honest discussion. If you don't think something has a high likelihood of success, share that with the patient. And usually what I'll say to them is I have some concerns about this working long term. And if you and I are on the same page here and we both accept those risks, then it may make sense to do this. But if it's high risk and the patient's not on board with that, then you don't have to do it. A lot of times I think, especially new dentists, and we see this on the state board side of the equation, they feel pressured as though they have to do certain things. You don't have to, and you probably should not treat every patient. If you don't think that's the right procedure, that's part of why people are called doctors as opposed to a technician.
Right.
And they can be hard lessons to learn.
And from a board, kind of an American Dental Association, I was at a meeting over the weekend, and I got to hear our executive director of the ADA speak. And one thing that Dr. Ray Colmia, and one thing I was super impressed with, and I've heard him give this presentation before, and I love this line item he says every time: I'm going to give you the information. Now, it may not be what you want to hear, but it's the truth. And that's so important.
Which gets back to balancing out people pleasing, right? Because I want someone to like me, versus saying, this is the information you need to hear.
And I don't want to get into being effective versus being right, but it starts to get into that balance. A patient has to like you enough to make you effective. So you can't just come in there with a lot of hard truths right off the bat.
Right. You're not flossing, you're not brushing. I think you're drinking sodas all the time. Yes. That's all got to stop.
That's so great. Thank you so much. I'm going to go now. Thank you for your time. I don't need that kind of negativity in my life from my dentist or elsewhere. So thank you so much. I think that's probably what a lot of people would react, be like, okay, even if you're right, I don't want to be told that.
And being self-aware enough to see what works for you, finding your own voice. Are you?
Oh my gosh! Don't get me started on this.
We actually have an entire YouTube episode on finding your own voice.
We do post-op calls, and I was doing my post-op calls one day, and he was saying my voice was too high-pitched, and I was talking like this.
When you get nervous, you talk really high like that.
And so I, as a joke, I was like, "Well, what do you want me to speak in a low tone, like a baritone voice?" And they can kind of guess what what I'm doing.
But finding your own voice. I did an executive fellowship at Harvard Kennedy School, and one of our best faculty there, humble brag, was a gentleman who was an advisor to 4 different presidents, and talked a lot about there's lyrics and then there's melody, and we referenced that a little bit earlier on. it takes time and effort and practice to get your melody, to be an effective communicator when you're communicating with patients, when you're communicating with staff, when you're communicating with partners. And it takes work.
And since we're on melody, and Mo Jones, I wouldn't say anything, but I do like your melody. You've done this before. And you have a good melody for this.
She does. She
really does.
Positive energy.
I meant it earlier when I said it, and I'm very sincere with this.
You are sincere.
I wanted to be your friend immediately, and I was like, I like her voice. I've met people and women sometimes.
You've met people.
I said people very specifically because sometimes when I meet women that have a very high and shrill voice, it's tough. And you hit it right at the right balance. You really have a nice melody.
Yeah. You are far too kind. Oh my goodness. Again, I'm blushing. I might start sweating now too, because just you're making me feel so good and nervous. But I mean, I think I feel like there's a certain extent where I try. Part of it's just kind of, this is just who I am, but I really do try to be intentional of how I present myself to others, because already, people who know me, I have a very strong, very large personality, and that can be a lot for people. And so I kind of try to find the balance of, even though I'm just kind of this big person overall, hopefully my voice can show you that I'm still a little anchored, and, I am approachable, and I'm nice, and I do want to be everyone's friend. So, I mean, let me tell you, it's halfway intentional. But real quick, we are almost out of time. So one more thing we love to leave our listeners with is what I like to call a motivational tip. And it's just one page out of your playbook that you could give to our listeners. That's something they could implement right now, today, to be successful and have their own happy practice.
You want to go first, Doc?
No.
I'm kind of stealing a page out of your playbook. I looked at your LinkedIn profile. I like to know who I'm talking to. One of the coolest things in your About section that resonated with me is how curiosity, and even from your childhood, you love to stay curious. I'm the exact same way. Stay curious, my friends. Don't be judgmental. Stay curious, because life is full of surprises, and there are so many opportunities to do different things and meet certain people if you stay curious and don't have a lot of judgment with it.
That has served you really well. She actually is not fearful of very many things. And you literally joined a hockey team when she didn't know how to skate. And I'm like, oh my gosh. And then it worked out just fine. Or riding motorcycles, staying curious is great. Mine would probably be figure out what you really need to do. And it may be a wellness thing. It may be, I'm stressed out in practice and I'm having a hard time dealing with stress. Well, figure out, have some tools in your toolbox, whether it's breathing exercises, whether it's meditation, whether it's going out for a walk your dog. Do something for yourself when you sit down and figure out, what do I really need to do? Because it can make a huge difference.
Oh, that's awesome.
Okay, stay curious and do something for yourself. I think our listeners can do that. That's simple. All right, well, that is a wrap for today. Steph, Bobby, thank you so much for being with us today. It has been so great. And thank you to everyone listening. If you liked what you heard today, hit that subscribe button so you don't miss out on our next episode. And we hope to see you next time. It's your girl, Mo Jones.